Our legs are the most dependent part of the body and they are farthest away from our heart. So the blood keeps on collecting and pooling there. So if you imagine the blood vessel, which is like a tube, it is a hollow tube, but it is filled with the blood. You're going to inject this jam kind of material or glue, you call it. It's a medical glue, and that gives a kind of permanent seal.
Welcome back to Season 2 of Health Charcha, the podcast where we simplify healthcare, share real stories, and explore breakthrough medical innovations that make a real difference. I'm your host Kartik, and today's episode is all about moving forward with treatment advances for varicose veins and what recovery looks like afterwards. Previously, we have uncovered what varicose veins are, how they develop, and why early detection matters. Today, we are taking the conversation a step further, diving into modern treatment options, especially game changers like adhesive therapy, and understanding what life looks like after treatment. Joining us is Dr. Saurabh Rai from Bangalore, a vascular surgeon at NH Hospital who has been at the forefront of diagnosing and treating venous condition. Welcome, Dr. Saurabh, and thank you so much for being here, and thank you so much for sparing your wonderful time.
Thanks, Kartik. Thank you for hosting me.
Sir, before we dive deeper into this conversation where we talk about the treatment and the post-care, there is a journey of treatment. And before we talk about the journey of treatment, can you shed some light on what varicose veins are, how they develop for all our listeners and viewers who are actually watching us and listening us at this point of time?
Yeah, it's very relevant. Let's start from what exactly the varicose veins are. The veins are the blood vessels which are visible. They can be visible on the hands or they can be visible on the lower limbs. You have seen the laborers, you have seen the exercise people. The veins are visible in the upper extremity. But as far as these varicose veins are concerned, they are primarily, we are talking about the lower limbs.
Okay.
And in the lower limbs, they become visible because nowadays, most of us are either standing for long hours or sitting for long hours. Varicose vein have been described in the medical literature from 2nd BC. So it's a very old disease. It is not something which is new. And therefore, the doctors have tried various treatments right from the beginning, from 15th or 16th century, how to treat the abnormal varicose vein. Every vein which is visible is not abnormal. There are certain criterias. There is one of the criteria is how big they look, whether they are straight or whether they are curvy. And more importantly, are they giving any symptoms, any problems to the person who's having these apparent veins.
Okay.
So under those conditions only, we actually talk about the treatment of these veins.
Doctor, when we talk about varicose vein, there are simply signs and symptoms that people get to know. And because of the advent of technology, Google Baba is there, the Internet Baba is there. We also have a habit of going on the Internet and reading about the signs and symptoms. And traditionally speaking, varicose veins have a condition where you feel leg pain, where you have swelling, and people tend to neglect it because they feel that it's a temporary pain, it's a cramp. So how can one differentiate between a varicose vein and normal leg pain or a cramp that they feel? Because right after this, we are going to have a conversation about the advanced treatments. So before we move towards the advanced treatment, if you can differentiate the fact between a normal leg pain, a cramp, and varicose veins.
It's very, very important question. So thank you for raising this point. Everything that looks enlarged does not mean it is a varicose vein.
Okay.
There are lots of reasons we get the pain in the legs. Every leg pain should not be attributed to a vein which is visible there. Varicose veins, as I said, they look unsightly, but every unsightly looking vein also is not a varicose vein. So these are big veins. They are rather than straight, bendy ones. They cause swelling in the leg, especially around the lower portion of the leg, around our ankle area. And this kind of swelling is not there in the morning when we get out of the bed, but as the day progresses, the swelling comes on. And with the rest, the swelling goes off. People can also have heaviness, discomfort, itching. Because, as you mentioned briefly, that it has been neglected by most of the people. So unfortunately, whether it is the Western world or this part of the world, we see the patients where they have developed the complications due to the varicose vein. And the complications of the varicose veins are the skin starts getting darker in color.
Okay.
We being in this part of the world, we still ignore that because our skin is naturally brown in color rather than the white color. But then the next stage is when they develop actually the wounds, which in medical language we call ulcer. So simply the open wounds. And people think that it is an eczema or it is some other condition which is causing it. But actually the veins may be responsible for the wounds.
Doctor, human body is actually a framework of a genius mind. And we know this because the kind of physiology and the anatomy that a human body carries. And now that we have talked about this disease that is varicose veins, new sort of modern treatments have actually come up into existence. There is glue therapy or adhesive therapy that a lot of people talk about, and right now medical science is on a boom where we talk about glue therapy, adhesive therapy, and it sounds very intriguing. Could you share some light on this?
So definitely. I'd love to do that, but I will take 2-3 minutes of your time
Sure.
just to go in the historical aspect of the treatment as well. Because if we build up the present on the basis of the past, then it will be more, the
Correct.
foundations will be better, it will be better understood. So what the surgeons or what the doctors have been doing for centuries, and I'm talking about from at least 15th century or even earlier, that they used to remove the vein by doing some sort of operation.
Okay.
So any vein which is looking visible or the doctor thinks or the patient thinks is giving the pain, the trouble, the ulcer, the wounds, we will try to remove it by surgery.
Okay.
Now the surgery got modified over the centuries because earlier there were no antibiotics, there was no step to prevent the infection which comes when you use the instruments which are not clean. Our instruments also got modified over the centuries and centuries.
Correct.
But still the main modality of most of the treatments for that matter, not just the varicose vein, if you think about it, something which is structurally defect is people wanted to remove it completely.
Okay.
So surgery was a very conventional treatment. And as the surgery evolved, from the major surgery, it has become a minimally invasive surgery. So what we used to do is rather than removing, we used to remove the veins, but what we now moved on to do is rather than removing the veins, let the vein be there, but somehow if we can stop the flow into that, which is in the wrong direction, then structure is not going to matter. It is the flow which creates the problem. And if somehow we can stop the flow, our treatment will be successful without giving the complications associated by making the cuts, which gives the infection, the pain, the difficulty in the movement, and other complications associated with that.
Okay.
So what has happened that through the pinhole, we started putting small, simple plastic tubes, which we in medical language call catheters. And these were connected to some kind of generator, you can imagine. And that generator will introduce some energy in the form of heat. And that heat will make some changes in the structure of the vein. To just give you a rough example, it does not exactly correlate with that, but how we boil an egg. So egg is in a liquid form, but when you subject it to a high heat, then the protein becomes solid. And even after that, once you have changed that nature of the protein, even if you put that in the fridge or in the Antarctica, you take it there, it is not going to get liquefied. So the flow inside the egg will stop flowing. Something similar we wanted to achieve or we have achieved by various thermal methods, by giving the various heat methods. And this heat can be generated. Just to give an example, you can make your tea over a traditional oven. The electric sets are there now available.
Correct.
Similarly, you can use the radio frequency, you can use the laser, or you can use the steam actually. And all these three methods, they introduce a very high heat inside the body.
Okay.
So when you are giving high heat inside the body, your only idea is to burn the vein or stop the flow, but it should not cause a damage, what we call the collateral damage to the surrounding structures.
Okay.
Because then the complications will come. And that is where the things have moved on. When you're trying to prevent the surrounding damage, you have to put a kind of coolant around it so that it absorbs the heat. It is a heat sink. And the skin, the nerves, other important structures, they do not get damaged because of that excessive heat.
Okay.
The things have moved on. Then the idea came that why at all we need to subject the veins to the heat? Why can't we inject something inside the vein?
Okay.
And if we inject something inside the vein that can stop the flow into the vein, then we don't have to give so many injections to put the coolant around the vein, or the patient will not have any damage associated with that subject of heat to the vein.
Okay.
I hope it makes sense.
It does, sir. Talking about glue therapy or adhesive therapy, however people want to address it, it is certainly becoming the talk of the town now, because there were times when you were talking about the traditional treatment options of any of the diseases, syndromes, or whatsoever conditions that a human being was going through. And now, with glue therapy or adhesive therapy coming into the picture, how are these therapy sessions different from the traditional treatments that people were actually taking care of?
So, yes, it's a very relevant, very important. You see, what happened, what has changed the treatment part is, in last century, we used to use the stethoscope. But then later on came the ultrasound scan and now the CT and the MRI.
Correct.
So, one equipment which has changed the therapy as far as veins and many other treatments are concerned is the invent of the ultrasound. So with the ultrasound, we can see where we are injecting, where we are putting the needle, where our catheters are. We can position it very well and we can treat these veins.
Correct.
So evolution of ultrasound has helped us as a doctor in treating this. So why not to use it for the vein? That is how the idea came.
Okay.
And how this material is different or superior to the other things which have been injected, because this is a very precise, very controlled, and it does not propagate in the areas where you do not want it to do.
Okay.
So with the ultrasound, we see where our delivery catheter or plastic tube is positioned, how far this material is going, and how it is actually interacting with the lining of the blood vessels where we want to stop the blood flow into those veins.
Okay.
Another example I will give you is when we are doing this treatment, it is like how we make a jam sandwich or something. So your two pieces of breads are there, you put the jam in between and you put a little pressure and that basically makes it fuse together.
Okay.
So if you imagine the blood vessel, which is like a tube, it is a hollow tube, but it is filled with the blood. So what you're going to do is you're going to inject this jam kind of material or glue, we call it. It's a medical glue. It's not an ordinary glue. So it's a medical glue. We inject that. It's a medical grade glue, which is tested over various times. And then you inject inside the vein and you put a little pressure over the vein. So the vein wall is meeting together, fusing together. Blood gets displaced and this glue directly seals the two opposing surfaces or two opposing walls of the vein, if you can imagine.
Okay.
It is it polymerizes very quickly within 30 seconds. Blood is not there, therefore interaction with the blood does not happen.
Okay.
And that gives a kind of permanent seal and the blood cannot travel in the area where it is not supposed to travel.
Okay. But doctor, just to follow up on this, right after getting a glue therapy or an adhesive therapy, for a patient, how much time will it take for him or for her to actually resume their daily activities? Because, we are living in a world where, everything needs to be done in a friction of a second. Even if you go out for a surgery, people from your office might call up and they will ask you, when are you going to show up next? So when can somebody who has gone through this therapy session can resume their digital and their normal activities normally?
That is the biggest advantage with all these newer modalities.
Okay.
I think that is a very strong driving force as well. Whether it is this part of the world or whether it is Western world.
Okay.
We don't have time even for our medical treatment. So we want something effective and quick without any problems which restricts our activity after the treatment.
Okay.
So once you have injected this glue inside the vein, you can actually walk off immediately.
Okay.
In fact, with all these newer modalities, unlike the traditional surgery for the varicose vein, we encourage people to walk.
Okay.
A normal walking. Of course, we do not recommend them to go for a marathon next day because we are trying to stop the blood flowing into the blood vessel. And when you do the strenuous exercise, the blood vessels dilate. You might
Okay.
have seen in the weightlifters, the runners, or even simple you go to the gym and you see the veins become big. So we don't want the strenuous activity, but actually the day-to-day activities you can do straight away.
Hmm.
So you as a patient can walk into the clinic, we will inject the glue and you just walk out of the clinic and you can resume your day-to-day activities as long as not you're a professional athlete or gymnast. Even if you are there, maximum you're talking about 24 to 48 hours. So no disruption to your day-to-day activities at all.
Okay. And doctor, now that we have covered things about treatment and things about recovery, what lifestyle changes can patients adopt to prevent the reoccurrence of varicose veins? Because right now, every time when we go through something or the other, we blame lifestyle for it.
True.
Right? We say that, oh, the lifestyle has certainly changed. Things are becoming so fast paced in this life. And because of this, somebody is suffering through some syndromes, through some condition, or through some disease. So, what are those lifestyle changes that one needs to keep in his or her mind so that the reoccurrence doesn't happen?
We should be more active.
Hmm.
And active, I'm not talking about a one long haul walk in the morning, you have done it for 1 hour. That's good from the heart point of view. But as far as the venous flow, the return of the blood towards the heart is concerned, every 35, 40 minutes, a 5 minute stroll.
Hmm.
Now that concept is coming for the weight loss as well, that rather than sitting on the chair all the day, we should take a little walk. So that definitely helps. Even if you can't take a walk, at least to do the movement of the leg as if we are pressing the brakes of the car. So at the ankle we are doing the movement, at the
The
knee we should do
flexion, the abduction, yes.
correct, bending downwards and
Yes.
lifting it up. That helps. Weight reduction helps. And of course, for all this, the vegetarian diets or the food based diets, there are certain medicines also which have shown that our blood flow and the interaction with the cells are much better if we take those medicines, which are essentially the plant extracts.
Okay.
So, dietary modification, more active life, leaving the sedentary life, leg movement, foot movement, weight loss. There's one part of the treatment which has been used for the varicose veins as well, that is called compression hosiery. So these are very tight stockings. These are not the normal stockings which the ladies buy in the any garment shop. These are medicated hosieries.
Hosieries.
These are special tight socks, and they compress the veins of our leg from below upwards, mimicking the movement of the muscles.
Okay.
So these are the things, in my opinion, we can do which will prevent the recurrence or that will keep our veins healthy.
Thank you so much, Dr. Saurabh, for taking us through this incredibly informative session. And from the latest in varicose vein treatment to how patients can recover and stay healthy, it's clear that vein care has come a long way. With the right treatment and guidance, patients can truly reclaim their quality of life. That wraps today's episode of Health Charcha, issued in public interest by Medtronic. If you or someone you know is dealing with leg pain, swelling, or visible vein changes, don't ignore the signs. Today's treatments are faster, safer, and more comfortable than ever before. And for more details on advanced vein treatments and recovery tips, speak to a vascular specialist. Until next time, take care of your health, keep moving, and remember, knowledge is the first step to healing. Thank you so much, Dr. Saurabh, for sparing your wonderful time. And I hope you had a great session.
Fantastic. Thank you.
Well, this is your host, Kartik, signing off.